My name is Dr. Michael Pryce. I'm a practicing surgeon from Ohio. I am also the author of Anathema, America's War on Medicine. For those of you who have never encountered the word anathema, the dictionary defines it as a person or thing that is detested or loathed, such as that subject is anathema to him. It means something that is held in abomination. In modern-day vernacular, it simply refers to an outrage. I could not think of a more appropriate term for the book than Anathema, America's War on Medicine. I wrote this book to try to educate the American people about how the best healthcare system in the world has been nearly destroyed by various forces, including the American government, insurance companies, lawyers, doctors, and yes, even the American public themselves. In 1970, America was ranked #1 in the world with the best health care anywhere. That time was referred to as the golden age of medicine. Doctors were making more money than at any time in the history of their profession. However, they were not gouging the public. Simply, there were not enough doctors to go around. Long hours and many patients resulted in large incomes. But it only cost $356 per person per year for health care. That means that America had well-paid doctors, but the health care was extremely cheap. Compare that with the fact that today we have doctors being run out of business, insurance company presidents with billion-dollar bonuses, and hospitals looking like spas rather than the institutions of health care. The United States has the most expensive health care in the world. It costs over $8,000 a year per person compared to $356 a year per person in 1970. Now, the next closest country to us in cost is Switzerland, but their standard of living costs 3 times what it does in the USA. But their health care costs about a half of what it does in the United States. We have between 20 million and 40 million American citizens without any health care coverage at all. That is the same number that has been brought up in every presidential election since 1950. It is a conglomeration of people in between jobs, unemployed, students, indigents, and people who would just rather have a Harley-Davidson motorcycle than provide health care for themselves and their children. Worse than that, we have between an estimated 120 and 150 million people who have health care that cannot use their insurance policies. Now that results from high deductibles, expensive premiums, high and frequent copays, resulting in people writing premiums to an insurance company without the ability to exercise the health care they're paying for. That does not stop the monthly checks for the premiums, however. The insurance companies virtually have people paying for their health care out of their pockets while they run away with the premiums. Now we have an even larger problem looming. The government is about to strike once again with its poison-tipped pen. They are in the final stages of providing us with a bill that will not result in total health care at all. Their bill allows the insurance companies to continue their scam of overcharging us for our policies, underpaying our doctors and hospitals, and denying health care through policies that do not cover many of the basic needs of the American people. From the vision of a practicing physician, this is a bad bill. It is a political solution to a real-life tragedy that will not solve anything except ensure that elected officials continue to receive big payments to the re-election needs of congressmen, senators, and yes, the president himself. In part 1 of the book, Anathema, America's War on Medicine, I chronicle how the healthcare system was destroyed. In part 2, I offer a common-sense healthcare plan that puts the patient first and all other entities last. It is a healthcare plan written by a physician and not a politician. It will solve all the problems plaguing our country in an extremely affordable way and result in full and complete health care for you and your families. What the Congress is proposing, however, will not come close to even basic health care. In addition, Congress has determined that their health care bill is so bad that they have pointedly exempted themselves and all government employees from the plan. Now, if this is such a good solution, why are the White House, the House of Representatives, and the Senate, as well as all government employees, not included in this wonderful solution to our health care problems? There are huge numbers of new taxes written into this bill, taxes that will affect every citizen in America. The bill does not provide for health care to begin for several years, but the taxes begin immediately. From past experience, one can easily read into this scenario exactly what our government wants to do. They want their hands on that money. They want to spend that money on things to try to get reelected, and when it comes time to pay the bill for everyone's health care, they'll have no money left. And off they go, hat in hand, to the Chinese once again to bail them out. This is not the change we voted for, and we should not allow our government to vote on this either. I encourage every American to read about this health care plan and to stand up and force Congress to put on the brakes and listen to us, something they have not done for a long, long time. With this web page that introduces this book to America, there is a link for Americans to sign up to participate in a grassroots movement to force Congress to take the same health care they are pushing on the rest of us. Now, in French antiquity, there's an old fable that tells the story of a princess, whereupon being told that the peasants have no bread, she said, well, then let them eat cake. Well, where would they get the cake if they didn't even have bread? This story parallels the hubris of our own government officials. They have purposely exempted themselves from our health care plan. Now, this smacks of the old Russian Politburo. The government sets themselves up with a Cadillac health care plan while the rest of us suffer with an envelope that has health care written on the outside, and there's virtually nothing on the inside. Now, I propose that we set up a national referendum that the people of America vote on to force Congress to use the same health care they provide for us. The people of America have basically forgotten that America is a democracy first and a representative republic second. The Constitution leaves the people a safety valve to put the brakes on a runaway government, and I intend to initiate that very safety valve. Through referendum, we can force Congress to forfeit their Cadillac plan and take the same one they give us. Better yet, perhaps we should force them onto Medicare. This referendum can be written in a way that Congress cannot overturn it and the courts cannot review it. This will take a lot of work and dedication, but this is not an unknown enterprise to the American people. Now, I'm building an army in this war on medicine, and I intend to make sure that Americans get the very best health care that we can and stop this madness at the congressional level. Now, I will need volunteers in every state to organize and run the referendum effort in their states and to coordinate it through this web page. There will be a function on this web page to donate funds to make this happen. You do not have to cause yourself hardship to contribute to this effort, however. If every American only gives $1 each, we would start with $300 million, and that's more than enough to complete the task. Please join me in this effort. Read my book, and then sign up to help save our health care in this country from our irresponsible government. I'm Dr. Michael Pryce, and I thank you for your help.